Hello, I'm Dr. Edgar Campos of Mexicali Bariatric Center. Welcome to our YouTube channel. Today, we want to talk about 5 key points about your gastric sleep. The next 5 key points is the what to know if my sleep is failing or if it's not working properly. The first one and probably the most common of the key points is, am I gaining weight? Am I struggling to keep my weight down? Or I hit a plateau and I stall my weight loss and I cannot lose more weight. So it's very common and very often that people call us and said, I have a gastric sleep. A few months ago or a couple of years ago, I lose some weight and then I suddenly stop losing weight. So if you're not losing any more weight, or on the opposite, if you're gaining weight, we need to first evaluate, did you hit your ideal weight? Did you reach your goal? If say so, most of the patients, they lose more than 100% of excess weight loss and then regain some. It's normal. Regaining around 10% once you hit your ideal weight, it's quite normal. So a couple of pounds, it's quite normal. But that means that you hit your ideal weight. That means that you already arrived to your goal and then you can regain some. So what we advise is, if you arrive to your goal, just try to keep balance between a couple of pounds up or a couple of pounds down. So check what you're eating, check your eating habits, check your lifestyle, and that means that your sleep is working properly. On the opposite, we have some cases that they never arrived to the ideal weight, that they didn't get to the goal. So if you're not getting to your goal and then you're regaining back, so if you stop in the middle and then you're going backwards, then we need to check your sleep. We need to evaluate that your stomach is in a proper shape, or we need to evaluate if you need a conversion to a surgery. So that's quite important to take a look. The other one is, second point, acid reflux. Most of the time after a gastric sleep, around 17% of our cases, they can have some acid reflux. And most of the time acid reflux, it's basically bearable, or you can just control your acid reflux with over-the-counter medication. In that case, acid reflux is not a reason to convert the gastric sleep to another surgery. But even with the medication, even with the change in the eating habits, even with the lifestyle, exercise, and losing more weight, you cannot control acid reflux with normal medication like proton pump inhibitors or topic medications like Mylanta or Carafate. Then we need to review that. And most of the time we can review it through endoscopy, or we can review it with a barium swallow. So once we know that you have probably a hiatal hernia, or your fundus is so big that it's producing a lot of acid, or the eating habits are quite bad that you provoke yourself acid reflux, then we need to change everything. But even if you're doing everything good, you're not misbehaving with coffee, a lot of coffee, spiced food, or acid in your diet, and you still have a lot of acid reflux, then we need to take care about that. So most of the time we can review it with endoscopy or barium swallow, and if we spot a hiatal hernia, then we can fix that hernia and stop the acid reflux, and that help you to lose more weight. Or if the stomach is so big that you still have some part of the fundus, we can remove that fundus and fix the hernia. And in some cases we can convert the gastric sleep to a gastric bypass if you have a lot of acid reflux. The third key point, am I eating too much? Most of the time our patients ask that question. It's, doctor, has been 5 or 6 months after my surgery. Am I eating too much? Am I eating more than I can? My sleep is not working. Did my sleep has gone back? There's something wrong with my body? And probably the answer is no, we need to check. So it's quite common that with a gastric sleep, sometimes you can eat more and sometimes you can eat less. So our experience said that some days you can eat more and some days you can eat less. But you need to have like a reference point. For example, if before my surgery I was able to eat 4 tacos, and right now, on the very beginning, I was able to eat probably half a taco, and then suddenly I can eat 3 tacos again, then something's wrong. Then my sleep's stretching, or my stomach is so big. But if you just jump from half a taco to a full taco, basically it's normal. Your stomach gets relaxed and you can allow more food in your system. But then suddenly probably you'll return back to half a taco. So what we advise to avoid eating too much and stretching your stomach, it's eat smaller bites, chew everything properly, eat small meals, probably 5 or 6 times a day instead of having one huge meal, because that will force your stomach to expand. So the more little meals that you eat during the day, focus on protein. Don't eat starchy carbs that will create a big burst in your stomach. So once you focus on how you're eating, and if you can evaluate the quantity of your meals, probably you'll feel much better, and probably you have a reference point. But what happened if suddenly over the years you begin gaining weight, and instead of eating one full taco you can eat 4 again? Then we need to go and review your sleep. We need to check if there's something wrong with your stomach, if it's so big, and we can do a sleep reconstruction. Or probably if the quality on the meals is so bad that you're stretching your stomach, we need to review it to another option of surgery. Number 4, I don't feel restriction anymore. The term restriction basically means that your stomach is telling you that it's full, that it's time to stop eating, that you can handle no more food, or if you keep eating, probably you'll feel sick. The restriction is very often intense after the surgery, and it's often given with hiccups, shortness of breath, runny nose. So you eat something, you feel tightness in your chest, you feel discomfort, and if you keep eating, you'll throw up. So when you forget about restriction, could mean a couple of things. Either your esophagus is very big because you learn how to put food into your esophagus. So the sensors of the satiety are on the upper part of your stomach, on the top of your stomach. That means that if you're putting food in your esophagus, you're stretching that part, and then you don't feel restriction anymore. So in that case, what we advise is stay on a liquid diet a couple of days, so your stomach will reduce in size, it will diminish the inflammation, and then you can feel restriction again. Then recognize every new sensation. Even after a couple of years, restriction could change on the trigger. For example, if you used to have hiccups, and then after the surgery you get mucus or you get phlegms when you eat so much, well, listen to your new sensation. Probably the stopping sensation will be something different. So retrain again. The other thing is, don't eat until you feel burst or until you feel so full that you'll basically be able to throw up. Eat little portions and take your time. Normally the satiety sensors takes around 20 minutes to recognize in the brain. That means that once you feel full in your stomach, your brain will let you know 20 minutes after. But sometimes in 20 minutes you can eat more than you can handle. So what we advise is eat very slow. Again, take your time. Don't eat and drink at the same time, because water will be flushing down your stomach and then you will never hit the satiety sensation. So that's quite simple. But even if you're doing everything, even if you're eating without liquids, smaller portions, chewing properly, retraining your stomach to listen to the new sensation, but you don't have that satiety sensation, you don't feel restriction anymore, and you can eat and eat and eat and eat, then we need to review your stomach, we need to review your sleep, and we need to check if we either do a sleep reconstruction or we do a second step DS or a bypass. And the 5th key point, it's basically about head hunger, or I feel the desire to eat something. And it's very common. We can translate that acid reflux probably can make you feel hunger. But sometimes if you have a sweet tooth that you want to eat something, or you have desperation to eat something, probably that means that your stomach still produces a lot of ghrelin, and then the desperation and the hunger, it's because of ghrelin. In that case, we need to review that stomach and remove that part of your stomach. If you're eating a lot of sweets or a lot of fats or a lot of high caloric liquid, if you feel desperation or desire to eat something like very intense meal, then we need to review your stomach, because sometimes when you get that desperation to eat sweets or fats or high caloric liquids, basically your insulin levels are so high that you stop losing weight. In that case, we need to review, and probably we either convert your surgery to a malabsorptive surgery like a DS or a bypass, or check if you still have a large fundus that will still producing a lot of ghrelin, and then we can staple and cut that fundus and remove that part of the stomach so you diminish the ghrelin production. So in that case, with these 5 key points, we can review your stomach, and if you're candidate enough, we can do a surgery we can review your stomach, and if you are candidate enough, we can do a surgery to correct any problem, or we can change your eating habits again and put you right back on track. Thank you.